What are fibroids? Fibroids, also known as uterine leiomyomas or myomas, are non-cancerous growths of the uterus that often appear during childbearing years. They are composed of muscle cells and other tissues that grow within the wall of the uterus. Fibroids can vary in size, ranging from small, pea-sized growths to larger ones that can be several inches in diameter. Here are some key points about fibroid. Part 1. Prevalence. Fibroids are quite common, particularly in people between the ages of 30 and 50. It is estimated that up to 70 to 80% of individuals with a uterus will develop fibroids at some point in their life. Part 2. Location. Fibroids can grow anywhere within the muscular wall of the uterus. They can be found on the inside of the uterus, submucosal, on the outside of the uterus, subserosal, or within the wall of the uterus, intramural. Part 3. Symptoms. Not all fibroids cause noticeable symptoms. When symptoms do occur, they can include heavy menstrual bleeding, periods that last longer than a week, pelvic pain or pressure, frequent urination, difficulty emptying the bladder, backache or leg pains, constipation, and enlargement of the lower abdomen. Part 4. Causes. The exact cause of fibroids is not completely understood. Genetic factors, hormonal imbalances, particularly estrogen and progesterone, and changes in growth factors are believed to play a role. Part 5. Risk factors. Risk factors for developing fibroids include being of reproductive age, having a family history of fibroids, being overweight or obese, and being of African descent. Part 6. Impact on fertility. In some cases, fibroids can interfere with fertility. Depending on their size and location, they can block the fallopian tubes, disrupt the implantation of a fertilized egg, or obstruct the cervix. Part 7. Diagnosis. Fibroids are often diagnosed during a routine pelvic exam or prenatal ultrasound. If further evaluation is needed, imaging tests like ultrasound, MRI, or hysteroscopy, inserting a thin, lighted tube through the cervix to view the inside of the uterus, may be used. Part 8. Treatment. Treatment for fibroids depends on factors like the size, location, and symptoms they cause. Options may include medication to control symptoms, non-invasive procedures like uterine artery embolization, or surgery to remove the fibroids or, in severe cases, the entire uterus, hysterectomy. Part 9. Monitoring. In cases where fibroids are small and not causing significant symptoms, a healthcare provider may recommend a watch-and-wait approach, with periodic checkups to monitor their growth. It's important to note that while fibroids are generally non-cancerous, they can sometimes be confused with other conditions, like ovarian tumors or uterine cancer. A healthcare provider can perform the necessary tests to provide an accurate diagnosis.